So Sarasota Tim went to see his cardiologist, or so he says. Now, I have a lot of doubts around this cardiology visit. And you would probably say, hold on, would you be able to question somebody that has gone to see a doctor or, obviously look at his age. This makes sense. I can let you know, watching this video, even reading a comment in Tim's comment section, I have some serious doubts about his honesty in his cardiology visit. And let me just roll out my fair use, and I'll explain how I have experience. Obviously, I'm sitting here in scrubs, and I'm just glad that he picked this topic. And we're going to get into this one because this one is wild. So watch till the end, because at the end, I'm going to talk a little bit about my friend who is a nurse practitioner who specializes in cardiology at the hospital level, has done cardiology for years. I actually met my friend at the heart hospital in our local area, and she had an interesting take on Tim and his cardiology numbers. So you get to hear Tim and how laissez-faire and supposedly how, you'll hear Tim. Anyway, let me get on my fair use. All right. So, yep, this is fair use. I'm going to use Tim's content, some of it. I'm going to skip over that boring, that cheesy intro that he has. And obviously, this is my opinion. This is my commentary. Obviously, occasionally I rant, but I don't dislike anybody, but I don't bully anybody, unlike Tim. And I really do ask, if you like this type of content, make sure to subscribe. And if you can watch the video all the way to the end, it really helps me with the YouTube algorithm, especially after the multiple channel strikes that I have received from Sarasota Tim, because he does not like my commentary, because I call out his problematic personality disorder, which leads to his manipulative behaviors of his audience. And so we're going to talk about that a little bit today. And but before we begin, I did want to thank everybody who has been so awesome in my community. My name's Ray. If you're new to the channel, YouTube doesn't promote me a lot, so that's why I asked my loyal subscribers, of which I have a lot, to watch till the end. Even if you get bored, just let it play. Just walk away. Go do something for 10 minutes. Just roll it out, because it really helps me, and it will mean that YouTube will continue to send my content, and I can warn more people about Tim that way. So that's a big help to me and the channel at this time. So I appreciate it. And my audience is awesome, because they have contributed so wonderfully to my legal action fund. Now, there's all sorts of rumors going around that, I'm going to serve Tim with papers, I guess, and this, that, and the other. And that's not actually probably the best route to really tackle Tim as a problematic YouTube channel influencer, content creator. I think content creator, that's probably the best word. So yeah. And so I've made notes, because if you don't know, I am a registered nurse here in the United States. I am also trained to be a psychiatric mental health nurse practitioner, but I do not treat or diagnose. And I'm not that far from graduating. I just need to get through my clinicals, and I will be able to practice as a nurse practitioner specializing in psychiatric mental health. So I actually came from a cardiac nursing background, dealt with a lot of patients in cardiac rehab, a lot of issues that people have around depression. I have years of experience in cardiac nursing. Cardiac is like my wheelhouse. That's why I have a really good friend who works as a cardiac nurse practitioner. And I was going to actually go into the specialty of cardiac as a nurse practitioner. That was my goal. But I became more interested in psychiatric mental health. And that leads me to our narcissist, our lying manipulator, in my opinion, obviously only, Sarasota Tim. So yeah, I've got this. So, but Everybody has really been so generous. So thank you. I'm going to get this going because I've already been 5 minutes in. That's long. I'm going to lose the audience. They just want to see the Tim reacts. And I will cut this up, my notes, okay? So we can get into Tim real quick. If you want to hear more about the legal action I am taking, you can actually join Life and Vibe community. And, when you do that, you get to learn more and look at members only videos. And there's memberships. Yeah, we have community memberships. Yep. So when you subscribing really helps. So for those, who obviously times are tough. So I understand, but if you are able just to like, comment, subscribe, watch all the way to the end, helps me build my legal fund against bullies like Sarasota Tim, who use copyright removal to try to shut down smaller creators or any type of creator who makes criticism, when in reality, I don't actually have the copyright certification required. And they potentially don't really understand how copyright works. And so they're happy to open up this legal process because a lot of people don't want to provide their own personal name and address and so forth and put in the details needed by YouTube in order to send the counter notification and for the other person to have to respond within 10 business days to say, hey, look, I have started legal proceedings, or I have already, taken this person to court because they are using my copyrighted materials. Unless you can show evidence or proof of that, then the person who was struck, have your video restored back onto YouTube, and obviously the strike is taken down. But the difficulty is that obviously the harm is already done. The harm is already done. So that's why I ask everyone to watch it all the way through, because that helps me get back out. If you do like this type of content, if you support people who don't agree with, manipulative Tim, who takes money from potentially elderly and vulnerable individuals. So that's part of why we don't like Tim. All right. And also, I know he's a narcissistic liar, and that's never a good person to be around. Okay. And I talked about doing my community. There we go. And I have here that something about the videos helps. That's what I talked about. Help me with the algorithm. So I got through that. Okay. So the biggest point I want to make is that I believe Tim is lying because Tim is vain. Tim is a narcissist, and Tim is extremely vain. And recently, if you have seen his content, everybody has noticed that Tim has put on a decent amount of abdominal fat, and in the gut, So it looks like he's definitely not going to the Planet Fitness. He's not making good dietary choices and so forth. And so I've also thought initially that, he was trying to save money, but he's trying to buy salmon. So I think he's trying to kick my theory. He watches my content. I know this because of how he talks about what he's taking medication-wise shortly. Tim. You may think you might become a cardiology expert, but you do not have oh my God, I think I have 6+ maybe more years in the field of cardiac nursing alone. And then I did oncology and kind of the other time, and case management for hospice, which covered every disease type, cancer, cardiac, you name it. And now I obviously do pediatric. And psychiatric. So I really think that your, use of Google is not going to help. Okay. All right, let's get going because people want to see Tim. So let's make me small. We have him sped up. Oh, not that small. Let's get him to 1.5. And let's hear Tim, and let's hear the real cardiac RN take down Tim.
Tell you what it's all about. It's all about the money. It's always about the money. No, I'm just kidding.
I'm sorry. I skipped Tim's intro because I think he's trying to get people on copyright with that intro, and it's cheesy as F. In my mind, I'm not going to use bad language because I am a professional. But I thought it was kind of just, I guess that was what they were doing that one night when they stayed in. They were making like Tim's intro. which, you know, I think is kind of passe in YouTube at the moment. Any good YouTuber, like with really good content, I don't worry about that stuff anymore. I throw in some fair use and subscribe because I'm trying to build my channel and I'm just a shameless plug artist. Okay. All right. Keep going, Tim. I'm looking at my notes. All right.
I actually have some serious, not serious, I actually have some needs, I should say. Take that serious out. Well, I mean, put it back in. My eye's kind of serious. Skin issues are serious. And I guess the heart's kind of serious. Wow.
Every time he laughs about it and like grabs the heart and stuff, it just, I've worked with so many cardiac patients. Something is just not sitting right. And the psychiatric side of my work, too. And, I often refer to the DSM-5 with text revision and talk about Tim's narcissism. And I probably should look into his compulsive. But Tim is vain. And Tim would not want to say, I need to change my diet and lifestyle because I need to lose weight because I don't like to look fat on camera. And he has a lot of carnivore supporters. And so he would not have to want to ever admit to vanity being the reason he would drop the carnivore diet and want to eat a little healthier, or his concerns that he's going to die early. He wouldn't want to say that. It would go such a 180 to kind of what he's presented himself as. And so I think, like I said, his narcissistic side is what's going to make him want to be vain. And Tim is extremely vain and he's on camera. I'm obviously not vain. I show up with like no makeup on and hair, and people say I look wrecked and all sorts of stuff. But I'm not here to have a pretty face. I'm just here to make commentary around people, specifically people who try to scam people using health stuff. Whether it's like, you know, bogus health claims, bogus health products, and so forth. And I know there's a lot of skepticism around those of us who work in traditional, Western medicine. But I can promise you, I've spent years in this career and I do a lot of reading and research and ensuring that what I am going to be doing for people who come to me in a health need, specifically mental health, that I'm going to safely and appropriately and in tandem with the patient, give them the best treatment plan possible that they can adhere to. Anyway, take it away, Tim.
Am I an expert on heart stuff now? You know, I told my doctor, a very cool doctor, by the way. He's, I'm sure he's my age or older, but he's not a young guy is what I'm trying to say. 30 years in the business. So I think he knows what he's talking about. And
too many details. This is where, when you start to think about, somebody who is using lies to manipulate an audience or somebody. And Tim spent years, going door to door selling oil change coupons. So Tim's got a gift of the gab. And he's a student of Tony Robbins. So, and probably twice through, I heard through his courses. So this, in my mind, and the way he describes the cardiologist, just doesn't seem, it does not, I'm telling you, this is not an event that took place. So he's leaving. We never actually see even, Tim is somebody who shows everything, yet we never see these doctor's offices. And it's almost like, is he really trying to be that, careful about revealing the locations of the doctor's office when he's so careless about revealing everybody else's, including his friend JJ's? Would it matter what doctor he was seeing? Why would anyone care?
He's very cool. And I said, what about this? And what about that? And while he was very calm and nice about it, he pretty much, dismissed all of the things that you hear about on social media, online, about statins and the pill you take to keep the muscles from, aching, and calcium test. I got an EKG today. And the only thing that shows, he said, was that I've never had a heart attack. Well, I didn't think I did. So I'm scheduled from here on. I got a lot of appointments coming up. And unfortunately, I was warned that these cardiologists, they're booked. So you're not going to come in tomorrow. So my first appointment is April 17th and then April 8th. Yeah, April 8th is my first one. April 17th is another one. That might be.
Tim, why are you driving and reading a piece of paper? And I said in my last video that I never see him with a piece of paper or anything in his hand, and he suddenly has a piece of paper in his hand. It's not safe to drive and read a piece of paper, Tim. I'm making notes. He's trying to make this believable.
That'll be my follow-up, or the 23rd. I don't know. The whole month of April. And of course, I got to go back to my.
So Tim could have picked up a piece of paper from anybody, and it would be probably more than one piece of paper. It's usually, if it's real discharge, after having just seen a cardiologist, was that one piece of paper? It wouldn't be just one piece of paper. Was it just one piece of paper he had in his hand? I gotta see. Hold on, guys. I don't want to be boring. I just need to see if it was one piece of paper. I'm sorry.
One, that might be my follow-up, or the 23rd. I don't know. The whole month of April.
Sounded like just a piece of paper. Seems strange for discharge. Unless it was just appointment dates, but I don't know. Still, I worked in a lot of offices in medicine. Tim never sits right with me when he talks about stuff in healthcare.
And
maybe
of course, I go back to my eye doctor too. But let's stay with the cardiology. All right. I was prescribed a statin drug. And
okay, so he always goes back to the eye doctor, because I think that's really the only one he saw. I still have doubts about the dermatologist in some ways, because I feel like the bandage that was on his nose was the same type that was on his eye. So I still have doubts about it. I really do not believe Tim on a bunch of stuff. I think he uses this to go off and probably see Miss Tammy or something, and he just, doesn't want to show the time. I know he's vain too. That's why he wants to change his diet. Keep going, Tim. Let me see if you can become believable at some point.
And then I had experts in the comment section, and I say this jokingly because I know everybody means well. Hell, I don't know. I appreciate your opinions, but it'll give you dementia. It'll kill you. It'll this and all that. He said, get your ass back on that statin, because that extends life. People without statin years ago, life expectancy was here with statins.
I find it funny that he never actually mentions which ones he's on. He just says broadly the category statin. He never says like I'm on, Lipitor or Crestor. They don't give that one out as much anymore. There's a couple other ones, but he doesn't say any of those.
You go way up. Also,
Lipitor is the most common.
If you have a cholesterol of 248 and you eat.
Okay, I need to listen to him giving his numbers, because that's the other thing. So he broadly says statins. That's kind of odd. I'm running out of my envelope. So he broadly uses statins without saying really the name of the drug. And I mean, I guess people would say blood pressure meds and stuff. I guess people don't necessarily know the exact med they're on. So, but I still think he's not telling the truth. Keep going, Tim.
Let us the rest of your life. That affects like 4%. Or I can't remember everything he said, but I'm trying to make a video here. If you were to do a certain.
Yeah, let's see, too many details. I don't think the doctor would know off the top of his head about the statins. It would just basically say, your cholesterol is 234. We need your LDL under 70. You need to take a statin. And then if it was as high as Tim's and as stubbornly as long as Tim's, they would add now, especially with his age, Zetia or what's known as Azematide to his medication in order to get that number down quickly, because they want the his numbers down. I don't know what his LDL is or his HDL or his triglycerides. This is why it's so weird with Tim. Get one number. And Tim is an oversharer. So why, don't we have more information? Because the doctor would start to talk about getting that one number down. And since Tim is so high, this dose of statins would definitely have been adjusted. And like I said, they might add on the additional medication. And it's like a P something, P4, PK, Y450 inhibitor or something like that. PY450 inhibitor, something of that nature, but it's basically a Azematide. And they found out recently, there's been huge trials about that. And a lot of people have been adding, I think it's like a small dose, like 10 milligrams. Don't quote me on that one. And they've been adding that along with their statin medication that they've been taking to get down stubbornly high cholesterol or to get it down quickly. And I don't hear any of this as part of this supposed cardiologist conversation. And I find that interesting because your primary care would do that.
Certain diet, it would be, like 4% of what it would reduce your cholesterol number. So you go from 253 or whatever I have to like 249 or whatever 4% is. Percent, not numbers. Anyway,
well, that's why they add another medication on top of that. And obviously recommend lifestyle changes like dietary and exercise increase. But they're going to add another medication, Tim. And see, and this is how I know you don't see a cardiologist. Especially if supposedly you've been on the statin for a while. That means that you're not getting, either they're going to increase your dose or something. You wouldn't have just been told, get back on that statin. It's just not how it happens. Promise you.
Statin will take you from 253 down to 160, for example. So all of these things that people say, I am instructed.
What dose?
Whoever told me to do this, spot on about one thing. I got to start a baby aspirin. Yeah. So baby.
No, the person who was that was me. I don't think anybody in your comment section said that. You know how I scroll through your comment section. I want to see that. And I don't want it, post dated. Somebody putting that there. Because last week when I brought up everything about the American Heart Association, American College of Cardiology, etc., and the guidelines from, I think it was 2023, it was fairly recent, for coronary artery disease, especially chronic coronary artery disease, that the recommendation was, to be on an anti-coagulant and or an antiplatelet, depending on whether you had a history of myocardial infarction, i.e. a heart attack, to most people. But, it's funny that. I think that was me, Tim, who talked about the baby aspirin. Because it sounds like suspicious that you supposedly have heart problems if you've never been on a baby aspirin. And see, and your primary care could have put you on that. That's why I know you're BS-y. BS!
The aspirin, take the statin, throw away those pills that, counter effect the muscle cramps and stuff. They don't work. They don't do anything. He says the more and more people regurgitate that and talk about it, the higher the price gets. I said, doctor, I paid $30 for them damn pills.
He never said that. He never said that. That conversation never happened. I'm saying that doesn't, in my opinion. But yes, supplementation is not always recommended. And so I believe I called that out too. I don't think anybody in his comment section did. They're usually like steak, baby steak, or, just do what you want to do, Tim. Occasionally you get somebody be like, yeah, the Mediterranean style diet is good. No, and occasionally, like this one person talked about metabolic syndrome, which Tim doesn't have a history of diabetes and stuff. So at this point, Tim is not technically a candidate for metabolic syndrome. I don't know. I don't know if he actually sees any doctors really. They said the eye doctor because he doesn't want to go blind because he wants to keep on driving. And I can't figure out if he had the thing taken off that looked suspicious on his nose. He just had a big bandage there. It looked like the same bandage for the eye. Anyway, keep going, Tim.
And my primary actually, I got to go to Walmart. Walmart actually recommended them too. So there you go.
Oh,
different doctors. Of course, she's just a primary. She's not.
What do you mean different doctors? The other doctor is going to look at the list that your other doctor has you on. And they probably are going to add the baby. See, this is interesting. Because when did you suddenly see the primary about that baby aspirin? Because the other day, Tim, you only had that one bottle of pills on your countertop along with the CoQ10. So supposedly it was some type of statin. I think, I don't know which one. It's just statin. I don't know if it's Crestor, Lipitor. Oh, there's some others. I don't prescribe those types of meds. And then, oh gosh, there's all types. I'm thinking of them but atorvastatin is the one I see all the time. That's Lipitor. Anyway, the point is that how did you just suddenly see this primary care prescribing you this baby aspirin that was not on the counter that you were taking to DJ's house just this past weekend? Just, this sounds like a lot of stuff I said during my live when I brought up literally the guideline for coronary artery disease, which probably blew Tim's mind away.
And I love her. She's not a heart doctor though, but you know, she's
a lot of primary cares do a pretty decent job of managing their patients until anything really, irregular starts to happen with the whole beyond, sort of blood pressure management and so forth. But they do actually, a lot of primary cares are very, will do a lot of that management long before a patient sees a cardiologist. Most patients' interaction with a cardiologist, if something starts to be noticed.
He's regurgitating too, I guess, on what these pills are supposedly good for. Good for nothing, my cardiologist says. I'm like, who can I sell them to? Anyway, the number I got of 1,575,000 on my calcium, he said, I've seen 6,000. That does not mean anything. And
that's not true. And my friend said, okay, I know, I can't show her name or anything. So I asked her, what is he's 15? I think I said 1575, 1575, 1576. At that point, we really are splitting hairs. But the coronary artery calcium score, I said, well, I won't show my friend at all. But anyway, I had a conversation. I didn't flash my friend. I don't think anybody could have seen anything. I was too quick. Anyway, so I said, quick question. 1575 calcium or coronary artery calcium score. Would that be ignored by a cardiologist? It's nothing big. Appreciate your input. Plus, I think I said 234 cholesterol because I couldn't remember. It was around that. And she said, oh, no, that's very bad. $234 or total or LDL? I said total cholesterol. And she said, no, they need an LDL less than 70. They may, if she was talking about, if they had a 1575, maybe a cath, which I've talked about, coronary artery cardiac catheterization, or stress test if symptoms. So if no symptoms, you're going to get cathed because they need to figure out why you have no symptoms and a 1575. If you're symptomatic, they'll give you a stress test. And I said, I just let her know that who I was talking about. She said she hopes I expose him. That's what she said. She hopes I expose him because my friend, who was a nurse practitioner and has worked in cardiac for, oh my God, it's been a long time. Probably as a nurse practitioner, oh my gosh, probably I don't want to expose because she would be embarrassed. But it's been an extended period of time. So, I mean, getting close to 20 years probably. Between 15 and 20. Let's just keep it vague. But in that area, okay? So that's a lot of experience. Oh, no, that's very bad. Tim, you're an absolute, just flat out liar. This is just all, and I just, people always assume you can't call people out because they're sick, but this is just lies. And I really am a cardiac RN, and you can find my license in the Commonwealth of Virginia, and it's public information. So there you go.
Some of you have told me that doesn't necessarily mean anything. But when you do have something over 100 or 400 or whatever, he said that it is, you got some plaque, but That it can be on the outside or something like that. He's showing me these little hearts and showing me the plaque, this little swiveling thing, and plaque. As long as there's
Tim is so focused on making up his story, he can't even keep his hand on the steering wheel.
I don't think he said as long as there's good blood flow, but
how do they know?
You pull in here and park. Anyway, he said, we're going to do this stress test. And the EKG showed that doesn't prove anything.
Well, no, you're supposedly asymptomatic. So as my friend said, you only do stress tests if there's symptoms. She's following the guidelines. Liar.
Other than you just never had a heart attack. And we're going to do the stress test. And then he wants to do, I don't know, some other thing. And
there's multiple reasons to do EKGs, other than just to see if somebody's had past myocardial infarctions. There's all sorts of reasons. Promise you. Anybody who works in cardiac electrophysiology will live and die by that EKG machine. Figure that one out, Tim.
And he says, you may not need a damn thing. You may be good to go. He asked me all about my health, my exercise, drinking, smoking, all these things they would ask, obviously. And
no, he didn't, because that's what the nurse does. And she fills that part of the paperwork out for the cardiologist, and he reviews it before he talks to you about just the heart stuff. So no, cardiologist really probably did not ask you those questions, because that's the nurse's job. His nurse on intake would have asked you those questions, Tim. But you seem to have admitted the fact there's an RN who would have done a very long intake process with you long before you even spoke to that cardiologist, who would have asked you questions around all of the history that the cardiologist would have seen. And so that is not something that they potentially would have asked. They would have reviewed that, not the way you're talking about it, Tim.
And he was very optimistic, and I guess he observes a lot of his patients when they come in. And,
well, of course he's optimistic, Tim, because if he's not optimistic, then how are you going to pull this story off? How are you going to suddenly go from being almost at death's door with a 1575 coronary artery calcium score that my friend said, oh no, that's very bad. And literally, now you're off to a stress test. You're not going to do the cath, because then you'd have to really have stuff going on. You'd have to have some, you'd have to read and have a little more expertise about that procedure to try to, this is such.
Their age and how they act and their previous, heart or health issues or drugs they take and things like that. So it doesn't say I'm out of the weeds yet, but he's relieved my concerns about that 1575 calcium score.
Well, that's not a good cardiologist then. I think you need to get a second opinion.
And what is it? What is it here? Let me try to eco thing. I guess at that stress test. So they're going to do that, and then they're going to, I'm not so.
It's called an echo. This looks like he's got just one piece of paper. Yeah, because I said he never seems to have paper in his hand, or maybe he printed something out to help him remember this. He didn't see a cardiologist.
Supposed to take anything that ends in OL. Prior to something. I got the instructions here. So
that was probably from the eye doctor. That's why he flashed it up so fast. That's some eye doctor instruction. No, I promise you. I don't trust him. He printed it out somewhere. Bullshit.
I guess my Tylenol eye drops I won't do. And no getting around children under 6 for 24 hours due to radiology or radioactive. I'm going to glow. Anyway, got these tests coming up. Didn't do anything but consultation today. He was really cool. I'm glad I met him. And he dismissed a lot of the concerns that I hear about. I've read about myself and I've been watching.
Oh, no. He looked like he was shaking when he was holding that paper. He looked nervous. The eye drops, that probably would have been asked to be held for your I would say your eye procedure, Tim, not your cardiac procedures. They don't care if you got eye drops in or not. They're not going to mess with your glaucoma. And all the Ols, Timolol, that's your eye drops, Tim. That's your eye drops. That's the instructions you received from your eye doctor. And you're using those surgical instructions to make up a lie to your audience. Because the cardiology people, we don't care if you did some eye drops. And they're going to probably, I don't know for the stress test, if they're going to tell you to hold off on your metoprolol. Definitely know if you're going into a cardiac catheterization, they're going to want you to have taken your metoprolol. In fact, if you had not taken your metoprolol, they're going to send us, the nurse, to go get you a dose, 25 milligrams prior to it. So, not sure, Tim. Sounds like potentially you're not telling the truth.
Online and the diet. So I don't know what, I'm gonna have to ask him again. He did not condemn carnivore. He did not condemn Mediterranean. When I brought up Mediterranean, he did say, you know, people talk about
It's not true.
diets, but diets will only, now I'm repeating myself, possibly change 4%.
That's not true. Why is it 4% with the statin and now 4% with the diet? Tim, your lies are terrible.
Statin, you know, so if you want to lose weight and things like that, then, you know, maybe the carnivore is okay. Any diet, I guess, where you have less calories.
There is no cardiologist who would have told Tim that the carnivore diet's okay. That's why this lies start getting spread on the internet, because you've got manipulative narcissists like Tim who just tell blatant lies. I promise you, no cardiologist with their salt said that.
Coming in, then you got going out, you're going to lose weight, right? That's simple math. What else was I going to say just now? He did my blood pressure. It was on border of being, you know, elevated, but it wasn't.
No, he didn't. The nurse takes the blood pressure before you walk in. The cardiologist doesn't take the blood pressure, Tim. This is how I know you're absolutely lying. It's a shame that they was actually going to probably watch this to the end to actually hear me call you out on so many lies. Let me ask you a question, those of you who are familiar to seeing a cardiologist. Is it your cardiologist who took your blood pressure? Or was it the nurse who did a bunch of stuff like that before the specialist walked into the room? Let me know in the comment section down below.
You know, like 140/80 or something like that. He warned that cheese, pretzels, this, that, and the other that do cause high blood pressure. He said it's not.
140/80 is really hypertensive. There's a new standard in the guidelines. So, you know, the people in your comment section who told you that 140/90 was normal, they aren't cardiologists. And they certainly aren't aware of recent guidelines. And since I am a good way through my postgraduate program, and I've had to study, you know, general medicine in order to get to the specialty part, which means I had to do advanced pharmacology and advanced pathophysiology and take advanced classes in all of these general medicine, you know, before I arrived to my specialty. And I can let you know that Tim is not telling the truth. Okay. Well, the doctors don't take the blood pressure. This is how we all know this is a lie. Keep going, Tim.
Not. What is it that causes high blood pressure? I said. He said it's the salt.
Oh, that's right. Salt. I was finishing off the guidelines. It's 130/80. That's the new guideline. Okay. It's not 140/90. It's 130/80. 140/90, they would be extremely alarmed with the 90. Very alarmed. And 140/90, that's just doesn't really make sense. But those are the parameters for normal blood pressure. So the fact that you rolled and your blood pressure sat exactly at the parameters for normal makes me my narcissistic friend here. And I guess they are able to come in for therapy if they want it.
So no salt for me. And I said, I check my blood pressure. It's always, you know, normal. And I don't want to take a blood pressure pill if I don't have to. And he said, yeah, keep checking it. But, you know, last night, it's all I had.
Yeah, that calcium score at a 140/90. He wouldn't keep saying checking it. It's just that Tim is going to have no evidence to back this stuff up. This is just a lie. It's just such a bad lie. And I'm going to keep calling it out. Keep talking about your heart, Tim. I love it. Keep getting real deep into it.
The refrigerator before I made that salmon was, I just bought, you saw it at the grocery store at Walmart, 2 big things of Kraft cheese. They're out. I guess maybe a piece here and there, but it's just like drinking. He said, if you can't drink, it's 1 drink a week, or is it a day? Might be a week for a lady and 2 for a man. Well, that's like not drinking. So when doctors tell me you got high blood pressure if you don't quit salt, you're going to do this if you don't quit drinking, you're going to do this if you don't stop eating this certain food, or
Tim's fantasy,
or blah, blah, blah. That's all I got to hear, and I'm out. So I will continue doing my exercise, doing the things that I do. I think that's
of course, because you're not going to have a lot of evidence for anything else. This did not happen. I'm so glad you talked about them taking the blood pressure and stuff, Tim. Oh my goodness, you're a very bad liar. A very bad liar. An extremely bad liar. But your audience, eats it up. And people actually bought it because nobody wants to. So bad. You could tell. I'm going to read one of the comments, but this is getting long. Go, Tim. Oh, just let me
definitely
see.
paid off for me.
So bad.
I told him I don't really get tired when I walk on the treadmill any more than the next guy that, if I put the thing up on elevation. But no, I don't run short of breath to where, in an instant, I'm having a hard time.
I think my favorite part of this is that when he starts reading out his, pre-op instructions from the eye doctor as his cardiologist discharge paperwork for his next cardiology appointment. There's no reason to hold your glaucoma meds. Absolutely none. They might tell you nothing by mouth, but your eye's not your mouth, Tim. And like I said, anything with an ending in the OL or the LOL, they definitely want you taking the metoprolol. They don't want your blood pressure sky high before a cath. But actually, if it's high, they'll probably ask you to please bring it down before they go into the room. So Tim is wild. Oh my God.
So back to the video. It looks pretty good, but nothing is definitive yet because he's got to do these tests, this ecology, something, stress test. And he said, we'll determine whether you need anything or just take your
What did you read, Tim? Okay, Tim, let me just okay. Oh my God. An echo, I think, is what you read online, and you're having a really hard time remembering what that is. Why are they giving you an echo? Do you have something that's indicating that you need you're having heart failure, or you're having some type of issue with a valve? Why are they doing an echo on your heart? They would go straight to a cath. Or if you were symptomatic, which like angina, massive shortness of breath, heart attack. No, not a heart attack. You'd be in this cath. You would be in the cath lab. But, more like chest pain or shortness of breath, they would put you on that stress test. And you either walk the treadmill or they medically induce. A lot of times they like to medically induce because it's easier to get people's heart rate to the level they need it to do in order to see what they want to see. And then they can give you a medication to bring you down. So that's often preferred. It depends. So, but that 1575 would be one of the two. And since you're asymptomatic, from what it seems, they would be ordering you a cardiac catheterization. This stress test, nope, that would be passed over. Okay. And the echo, no, you're not showing any signs or symptoms of things that would require having an echocardiogram at this point. Now, having an EKG, just to get, a basic picture of heart rate and rhythm. I'm sure every, cardiologist, but I don't think you were talking about problems with rhythm. I guess, history of potentially past myocardial infarction. Yeah. But most people would have had some type of symptoms, either a chest pain, and if it's just the widowmaker, well, that one generally, it's generally not a good outcome.
Your statin, because you got some plaque. That's obviously at 66 years old. A lot of people have some kind of plaque. If you have it somewhere, you got it everywhere. And he asked me if I ever have.
I already told you he would that 234. If you suppose he'd already been on a statin, they would add another medication to bring you down quickly or increase the dose. Don't just say get back on the statin. This is a nightmare to hear.
I mean, heart tightness or whatever. I'm like, not till today. Anyway, we laughed, we joked, we had a good time. I'm glad I met him. He's right next door to the other guy, and next door to the imaging place I go to. They're all right there together, all there with their hands out, waiting on those.
No, the only person who's waiting for any of that is you, Tim.
I simply asked. I said, I wish I could have that dry bacon. Well, I mean, you know what that is.
Yep, that's what you're doing, Tim. And you're just, I think you are vain. You don't want to admit to people that you are having, you don't like to see a big belly. That's, a medical term. And that's what's happening. This did not happen. No cardiologist is taking your blood pressure. No cardiologist is sitting happy with a 1575. They wouldn't send you to the stress test. You'd be straight into that cath lab. They're not going to tell you that a carnivore diet is acceptable, not with a dang 1575 calcium score. You can't get out of this, Tim. You cannot talk your way out of this bald-faced lie, except your face isn't bald, unfortunately. Your face is with that hair.
$45 copays. But now it's time to go into Walmart, return the shirt I got, get some more money.
45. That's a nice round number for you folks to send off to his buy me a coffee. Now he's going to go put some caffeine and, which a liar. He's such a liar. I think does he still have that thing on his nose? What supposedly happened under that bandage? I don't trust him.
Back from that $45 copay I just paid on my disadvantage plan, and then get out there the rest of the day, do some walking, do some exercising, do some eating, making some videos, just basically.
Yeah, and lying, and blatantly lying, and just massively lying. And I'm sorry. I know it seems like I'm so unkind and dead in the eyes nurse, and how dare I question Sarasota Tim? He's such a nice guy. No, he is an absolute liar. This is just his lies, okay? Trust me on this one. I have a lot of experience in this field, and I've worked for a lot of specialists at their office, cardiologists, and I've worked for oncologists. So I can promise you, no cardiologist is taking your blood pressure, Tim. You're just this did not happen. This can go into the Reddit. This didn't happen. Just because Tim is sitting on a video smiling and laughing and joking and doing this and moving does not mean this narcissist is telling the truth. And that's not even my opinion at this point. I know this one for a fact because of the fact that I have so much experience in cardiac nursing, Tim. This was a mistake for you to pick this specific specialty because it's all I smell. All right, guys, if you want to support me in this, I really appreciate it. If you did see this till the end, drop me some red hearts in the comment section because just having watched it really helps me out. If you really believe this man, I am so sorry. I don't know what to say, but he is absolutely lying. There was a comment I did say in this comment section that talked about, let me see if I can get this in. All this research. She was like about the fact, how sad that your physician wouldn't help you with that. It's not really about cholesterol. It's about inflammation and metabolic health. She talked about metabolic dysregulation, high blood sugars, and all this other stuff. Metabolic syndrome. Usually people who are diabetic have more potential for metabolic syndrome. It's just because you're reading something on the Google, unless you understand the broader picture of pathophysiology, you're just picking like little pieces. It's a much broader picture. But regardless of that, the cardiologist, that's why this is also dangerous, that Tim puts this stuff out here, because that's not the interaction that happened, and that he has the audacity to try to throw medical professionals continuously under the bus, because he's a pathological liar, in my opinion, and a narcissistic, grandiose one at that, in my opinion, because I can't treat or diagnose him. But he falls into many of these traits. And it's a high bar to hit, which is like, you need like 5 or 6 criteria across about 8. And he hits about almost every one. So, I mean, it's, like I said, I don't treat or diagnose him. Anyway, got me passionate tonight, because it's such blatant lying. It's just, and to get more money, from his subscribers. And then it's the, how dare you say something about a sick person. He's not sick, people, okay? This is just BS from Tim. And it's sad that other reactors in my community, I don't care, they all sit wishy-washy, whichever side of the fence. Some are strong in their beliefs, and I appreciate that. Others are just, whatever. I'm strong in my beliefs because I know Tim is a bully. And so, because he bullies me, and he specifically picks on me, and then he has the audacity to watch my content and then pick my information about cardiac. So, well, let's hear how much of this has been put into Tim's next videos. Let me school you on some cardiac, Tim. I'm irritated tonight. Liar, in my opinion. All right, I'm going to try to get more into the compulsive pathological lying and so forth. It's not really like a mental diagnostic. It might be sort of more considered like a trait of, different types of mental health disorders, rather than it being one on its own. But I think in psychology, definitely, there's a lot of talk about compulsive and pathological lying. Okay. All right. I've made this video long enough. All right. If you did like this type of content, make sure that you subscribe. I really appreciate it. Make sure to leave a heart in the comment section too. And that makes it even better. All right. Bye. Stop lying, Tim.